rule when the first cases began to appear. I know there are people reticent, but what we've tried to do is reassure them, says Regina Rogoff, the clinic's chief executive officer. We're here to serve patients, regardless of what their paperwork says. I'm hoping that's how our patients continue to see us. Even before the coronavirus arrived in the United States, having a large population that feels disenfranchised from the mainstream medical community heightened the risk for transmission of infectious disease, says Lawrence Gostin, a professor of global health law at Georgetown University and advisor to the World Health Organization. The first rule of public health is to gain people's trust to come forward. People who don't seek care cannot be tested or treated, and their contacts won't be traced, he said. The last thing immigrants want to do in this political environment is tell health officials about their friends who are also unlawfully here, Mr. Gostin said. More than 450 public health and legal experts signed an open letter early this month to Vice President Mike Pence and other federal, state, and local leaders demanding a fair and effective response to the virus, which would include a declaration that medical facilities are immigrant enforcement-free zones, as occurred after recent hurricanes and the September 11th terrorist attacks. ICE classifies medical facilities as sensitive locations where enforcement is avoided, though exceptions can be made. On Friday, after President Trump announced a national health emergency, the United States Citizenship and Immigration Services, which screens green card applications, appeared to signal that it was suspending enforcement of the public charge rule. A statement posted on its website said that seeking treatment or preventive services for the virus would not adversely affect applicants applying for permanent residence. If the alien is prevented from working or attending school and must rely on public benefits for the duration of the COVID-19 outbreak and recovery phase, the alien can provide an explanation and relevant supporting documentation, the agency said. The administration has not publicized the change, and absent a clear shift in enforcement, many immigrants are likely to remain reluctant to seek government-subsidized medical care. People who are fearful and are not going to be reading the fine print of People who are fearful are not going to be reading the fine print of policy, and if in doubt, they will stay away from being tested and treated, said Mr. Gostin of Georgetown University. For more than 25 years, the better part of their lives, Maria and Francisco Garcia have worked as undocumented field workers, picking and packing cauliflower, peppers, and dates in the low desert of the Coachella Valley. They recently became eligible to apply for a green card through an American-born child who turned 21. But with coronavirus cases on the rise in the area where they live, the couple have grown increasingly anxious about falling ill and jeopardizing their chance of becoming lawful residents. It was the reason their daughter, Mariana, attended the event in the parking lot in the Coachella Valley. My mom is panicked about getting the COVID-19. If she goes to the hospital, she thinks that will make her a public charge, says Ms. Garcia. Ms. Garcia was relieved to learn about the exception, but doubted it would assuage her mother's concerns. Her parents, who live paycheck to paycheck, also worry about not making the $500 monthly rent on their mobile home if they get sick. Sandy Corubias, 46, another undocumented immigrant, said in an interview that, "We're petrified. Even after learning that seeking medical help for the virus would not jeopardize her chances of qualifying for a green card, she did not feel reassured. The president says one thing one day and does another the next," she said. And if there were ever a closing quote that was more apt, I wouldn't know what it would be, because that one is it. That's the very procedure that the Trump administration has been using of creating fear, trying to keep people away, trying to keep people out, trying to make them not want to come here, taking children away. All these different things that they do has created an atmosphere where there is absolutely no trust of immigrants in what this country will do to them, how it will treat them, and what it means. So even if you change a rule, here or there, it doesn't matter, because they're not going to trust it and they're not going to believe it, because the administration has earned and worked hard to earn the reputation of hardliners who do not want immigrants here and will do whatever it takes to get them out. Excuse me for drinking, but one thing that I miss all the time at the studio is I never seem to remember to bring water with me, and so the longer I talk, the drier my throat gets. And the more of that I do, and the more coughing I do, and things like that. And so here at home, I would like to not have to do that. All the luxuries of home. Anyway, moving on. Our next article is entitled, Close Immigration Prisons Now. Inside an immigration court in southern Texas this week, a judge asked one of us to stand at the far end of the courtroom and not submit any documents on behalf of a client, perhaps as a health precaution. Inside a nearby federal court, dozens of migrants were being processed for violating federal immigration law. The coronavirus has paused most of our lives, but for migrants, life under a pandemic looks a lot like life before. Suffering before President Trump has an insatiable appetite for imprisoning migrants. Suffering because President Trump has an insatiable appetite for imprisoning migrants. It's time to shut down immigration prisons. Across the country, the federal government locks up tens of thousands of people every day who are suspected of violating immigration law. The Border Patrol crams people into holding cells that resemble large kennels. Immigration and Customs Enforcement runs a network of hundreds of prisons, from a county jail north of Boston to an 1,100-bed facility tucked in a southern Texas wildlife refuge. While it's good that ICE will stop some immigration enforcement, it should release the detainees in its custody. Another government agency, the Marshals Service, holds thousands more who are being prosecuted for violating criminal immigration law. No matter which agency is in charge, there are only two reasons recognized under U.S. law to confine these people: flight risk or dangerousness. But in this moment, the risk to life and public health that come with imprisoning migrants far outweigh either reason. But let's assume people released from immigration prisons don't do as they should. The very real risk of illness or death faced by the people whom Border Patrol and the Marshals Service locked up are enormous, compared with any downside of having people living, working, and studying in the United States who don't have the government's permission to do so. Even under normal circumstances, immigration prisons provide poor care. Last year, a teenager died of the flu inside a Border Patrol station in southern Texas. Government officials said an agent discovered him during a welfare check, but the facility surveillance video shows that the boy's limp body was found only after another boy confined alongside him woke to use the bathroom. In the fall of 2018, ICE botched a mumps outbreak in its prison network. A year later, there were over 900 mumps cases among ICE's detainees or prison staff. Clearly, none of us is living under ordinary circumstances. The Centers for Disease Control and Prevention tell us to avoid going out. We're told not to gather in groups of more than 10. Schools are shuttered, restaurants are dark, and some big city jails are reducing their inmate counts. The coronavirus's quick transmission and deadly track record is likely to worsen inside immigration prisons. Basic preventive measures are next to impossible. There's no social distancing because detainees live in cramped spaces. ICE doesn't even require that the person who oversees medical care be a physician. And we're skeptical of how much training staff members are getting now. During a visit with a client this week, we asked the familiar prison guard whether a phone that the visitors used had been sanitized. He said yes. Then he pulled out an ordinary bath towel. No alcohol or sanitizer was in sight. On Tuesday, the administration announced that it would seal off the border to people fleeing for their lives. There is no evidence that anyone requesting asylum has been confirmed as carrying the coronavirus. As of Wednesday morning, there were almost 3,400 more confirmed cases in the United States than in Mexico and Central America combined. Instead of resorting to xenophobic, baseless, knee-jerk reactions, the administration should immediately begin releasing migrants from custody. ICE can use its discretion to release people who are not subject to mandatory custody. For the rest, the Justice Department could suspend its 2009 policy that custody requires detention. Start with asylum seekers and families, then the people with green cards. After that, release the migrants who have families or friends in the United States whom they would join. Then go from there, and do it fast before people die. This is not the time for new variations on old fears. It's time to take the extraordinary, life-saving measure of closing immigration prisons. Well, that pretty much said everything that needed to be said about that. You've probably already seen the pictures. We all have, many times over. Kids in cages, you remember those. People crammed together in these big chain link things. They cannot perform any sort of self-care in those places. I mean, even aside from the general conditions that they're in, and they're close packed, so social distancing, of course, is right out. There's no way to get 6 feet apart from anybody when you have hundreds of people in a small room. Cleaning, you remember people being told to drink out of the tanks of toilets. I mean, there's certainly not enough water or soap to go around. There's nothing. They have no way of protecting themselves. All they can do is try not to breathe and try not to touch anything and fail at those things over and over again. So moving on, I don't know. I'm not even sure. I'm not even sure what else to say about this. I mean, it's all pretty self-explanatory. We are trying very hard to slow down the advance of this virus in all sorts of different ways. In Illinois here, the governor has pretty much just said, everybody stay home. We're shutting down the state, effectively shutting down the state except for the necessities of life. You're not to go anywhere, and there's not to be anywhere open for you to go. And that's pretty serious stuff. But if you're an immigrant, let's say you're an undocumented person, excuse me, you're an undocumented person who has a job. Yeah. Let me try that again. Let's say you're an undocumented person who has a job, say in a restaurant. Your restaurant's closed down. You don't have a job anymore. How do you eat? What do you eat? Where do you get food? How long can you stay in your current place? A lot of the places where people are living now, undocumented folks are living, are just basically rooms. I mean, they've got a room in a house. They're kind of unregistered. I doubt if they have leases. I doubt if they have anything like that. There's nothing, according to the rules, that keeps them from being thrown out because they're already operating without any rules. So these could be desperate times for a lot of people. And it is really important that we recognize their humanity and recognize the necessity of taking care of them because of their humanity, because they are people in need of care. If the only way that some people can be talked into having any concern is to point out that, yes, you will be in danger too if you don't take care of these people, then all right, let's bring that point up and make it as well. As long as there are people infected with the virus out there, we're all in danger. Every time you leave your house and go anywhere, if there is somebody else who's infected, they have the possibility of infecting you. So all you people who don't care about immigrants and just refuse to see them as human beings in need of help and assistance, you've got to realize that as long as they're there in these conditions and unable to take care of themselves, they are also a danger to you as well. And that is very important. And that doesn't mean let's just toss them all out of the country and let them die somewhere else, because that somewhere else, as long as they're dying there or infecting there, those infections are coming here sooner or later. We've seen that time and time again since this began. We shut off this border, we shut off entry from that place, and still it comes because people talk to people, talk to people, talk to people, and you can try and control that all you want to, but there is some link that connects you to the poorest, the most desolate and isolated places on this earth. There is a link that connects you. We live in a global society, whether anyone likes to admit that or wants to think that that's a good thing or not. It is the case. And what happens there will eventually affect you here. And what we do here will affect what happens there. So we have an opportunity to reappraise our isolationist, nationalist tendencies and this sort of move towards, I don't care what happens in the rest of the world, I'm only looking out for me kind of thing. Or even locally, these people are like, I just want homeless people to go away. I don't want to have to see them. I hate it when they come and ask me for money. So let's just get them off the streets and put them somewhere. That doesn't work. You have to deal with people where they are, how they are. You can offer shelter to the homeless. Some of them will take it. Some of them won't. Some may need to be, I hate to say it, forced into shelter because they suffer from mental illness or whatever. There are going to need to be efforts undertaken to help people that don't want help. And that's difficult. That's very difficult, but it needs to happen for everyone's sake. And the same thing is true about immigrants. So we need to be doing these things, and we need to be doing them sooner rather than later, which is what seems to be the case. Anyway, I wanted to read an article quickly here entitled "Shutting the Door to Legal Immigration," because along with everything else, and as you noticed from some of the things earlier, there has been a real effort by this administration to curtail legal immigration. And it's been successful in large part because they have been using existing laws in ways that those laws were not intended to be used. So this is still an important topic, and it's worth discussing. So I'm going to read this quickly. It's entitled "Shutting the Door to Legal Immigration." What is the new policy? Since President Trump took office, his administration has dramatically cut the number of people obtaining lawful permanent residence, in other words, a green card, from 1,063,289 during the 2016 fiscal year to about 577,000 in 2019. The number of visas issued to people intending to immigrate has fallen from 617,752 to 462,422 over the same period. Critics charge that the administration's efforts are racially motivated since they disproportionately affect lower-income immigrants from Africa, Latin America, and Asia. They point to Trump's repeated attacks on the diversity visa lottery program that annually grants entry to 50,000 immigrants from what Trump has described as blank hole countries. The administration counters that it's just emphasizing merit and skill and protecting the American taxpayer from a drain on the social safety net. What isn't in dispute is the effect. I don't think we have seen any modern president engage in an effort to reduce the number of immigrants the way this president has, said Kevin Johnson, Dean of the University of California's Davis Law School. How has that been accomplished? With a large number of rule changes. Rules for applying for asylum have been tightened, forcing 60,000 people to wait in camps in Mexico as their applications are processed. And referencing backwards, editorial aside here, to what we were talking about earlier, those camps are in desperate shape, and those people are in grave danger of contracting the virus and being vectors that infect others and causing untold damage. I was going to say untoward, untold damage here, there, and everywhere. Anyway, the administration has capped the admissible number of refugees fleeing violence or persecution at a historic low of 18,000, down from 110,000 in 2016. In January, Trump expanded his travel ban to 13 countries, including Nigeria, which accounted for almost 8,000 visas during the 2018 fiscal year. Also in 2018, officials announced that they would begin summarily rejecting applications for visas and green cards that contain any mistakes or missing documents without allowing the applicant to correct the error. Average wait times on the processing of such applications had doubled by the end of 2018, and officials are now insisting in most cases on in-person interviews. He's really ticking off all the boxes, said Sarah Pierce, an analyst with the Migration Policy Institute, a nonpartisan research group. In an administration that's been perceived to be haphazard, on immigration they've been extremely consistent and barreling forward. The public charge rule is another example of the White House's efforts to restrict legal immigration. What is the public charge rule? Reportedly, a singular obsession of Trump advisor Stephen Miller, it could prove the most significant change to immigration policy yet. Originally, the public charge rule was part of the Immigration Act of 1891 and was used to deny applications from idiots, insane persons, paupers, or persons likely to become a public charge. But in August, the administration broadened that evaluation to include 20 separate factors, including English language proficiency, credit scores, student loans, income level, and whether an applicant had received non-cash benefits for basic needs. In announcing the policy, Ken Cuccinelli, Director of U.S. Citizenship and Immigration Services, altered the poem at the feet of the Statue of Liberty, saying, quote, "Give me your tired and your poor, who can stand on their own 2 feet and will not become a public charge." A study by the MPI found the new rules could potentially have blocked about 2/3 of green card recipients from 2012 to 2016. In January, the Supreme Court lifted 2 separate injunctions that allowed the administration to proceed with the public charge rule, which had been called a wealth test for immigrants. What about fees? They are being raised across the board in an apparent attempt to dissuade the poor from even applying. There's a new $50 fee on applications for asylum, for example, which many destitute people fleeing drug gangs or political persecution can't pay. In November, Trump issued a proclamation that all green card applicants had to prove to a consular office that they planned to buy health insurance within 30 days of their arrival, or that they have sufficient funds for medical care. The order has been stayed by a federal judge pending a challenge, but if enacted, it would affect about 375,000 legal immigrants a year, or 2/3 of the total. Last spring, the administration released a proposal for a merit-based revamp of the existing immigration system. It would, if enacted by Congress, award applicants eligibility points based on criteria such as English fluency, whether they have existing job offers, professional skills, education level, and age, as well as a category called patriotic assimilation, which might include a test on historical texts like George Washington's farewell address. The plan, spearheaded by Trump's son-in-law, Jared Kushner, would rebrand green cards as Build America visas. Doug Rand, an Obama immigration advisor, called the plan an attempt to reverse the policies that enabled most Americans' ancestors to come to this country. Never before in our history have we closed off the American dream to strivers who aren't already middle class. he said. Critics claim that Trump's immigration policies are making an existing labor shortage worse. In January, before the disruption caused by the new coronavirus, the Labor Department released data showing that U.S. employers are trying to fill 7.5 million vacant positions, while only 6.5 million people were looking for jobs. It was the 11th month in a row that open positions outnumbered applicants, a reversal of a 20-year trend. Trump's former chief of staff, Mick Mulvaney, conceded the dilemma in February. "We are desperate for more people," he said. "We created 215,000 jobs last month. We are running out of people to fuel the economic growth." Complicating the issue is that much of the need is for low-skilled labor, such as home health care and restaurant and hotel work, which college-educated Americans are disinclined to do. The U.S. economy needs low-skilled immigrants much more than high-skilled immigrants, said Alexia Fernandez-Campbell at Vox. Businesses are having a much harder time finding construction workers, restaurant cooks, and hotel housekeepers than computer engineers and doctors, yet those are the types of workers that Trump's proposed merit-based system disfavors. And of course, some things about this article have certainly changed in the recent weeks because of the coronavirus. There are a lot of low-skilled jobs that don't even exist right now, and a lot of people out of work because of that. So it's certainly, now you could make a case that what we want are doctors and nurses more than anything else. But these things change, and they fluctuate over time, and they're never sitting in the same spot. It's not that you can say, oh, well, going forward, this is a great idea. Trump is stopping people from coming in. We don't need people because America is closed down right now, and more people are just more problems. That could be true today. It could be true next week, but it won't be true next year probably, or the year after that. And if we were behind before this happened, we'll be behind after this happened. Not for a little while. When things start up again, they're going to be needing people, and they're going to be coming back, and there'll be a lot of people out of work who will be needing work, and that's all well and good. But ultimately, if we want the economy to go and grow and be as it was and do even better, we're going to need people. And so what we don't need are laws put in place, systems put in place designed to exclude. We can have temporary situations where we say, okay, right now, stay away. We can't use you. But these things are being written in stone and by this administration, and that's a bad thing for the long-term health of this country. And I see that I'm more or less out of time. I thank you for joining me today. I appreciate your patronage, if I could call it that. You're listening to the program, and I hope that you are staying well and staying safe, and that you will do what you can for those who are less able to self-quarantine in style as some of us are able to do. So take care, and we'll see you next week. Bye-bye.